All right, everyone, welcome to week 2. Last week we talked about what ethics is and how it differs from morality. This week we shift into something much more real world, ethical dilemmas, the situations where there isn't an obvious right answer. And I want you to keep one thing in mind right from the start. Ethical dilemmas rarely look dramatic in laboratory medicine. Nobody bursts into the histology lab yelling, "Quick! An ethical crisis." Instead, they show up quietly. They look uncertain about a specimen, pressure to rush a case, disagreement about quality, or deciding whether to speak up when something feels off. Posgar describes contemporary healthcare ethics as being shaped by technology, complexity, and competing responsibilities. And honestly, histotechnology sits right in the middle of all three. You may not meet patients face to face, but your decisions absolutely affect patient outcomes. Every slide you produce becomes part of someone's diagnosis story. So today, we start looking at how ethical dilemmas actually develop and why they are unavoidable in modern healthcare. By the end of today's lecture, my goal is not for you to memorize ethical theories. Instead, I want you to be able to recognize when ethics is happening, because most ethical problems in healthcare are missed simply because people don't realize they're ethical issues yet. We're going to work towards 4 things. First, recognize ethical dilemmas in healthcare. Ethical dilemmas occur when multiple reasonable choices compete. Not right versus wrong, right versus also right. Example from histology would be, do you delay turnaround time to recut a block for better quality, or release slides quickly because surgery is waiting? Both priorities matter. That's an ethical dilemma. Number 2, apply ethical principles to complex situations. Posgar emphasizes that ethical reasoning requires structured thinking. You'll start asking, who benefits? Who could be harmed? What responsibilities do I hold as a laboratory professional? And yes, even embedding orientation or section thickness can become ethical decisions when patient care is affected. Number 3, understand competing professional responsibilities. This is huge in lab medicine. You will balance patient safety, physician expectations, institutional pressure, workflow efficiency, and regulatory compliance. Healthcare ethics often exists where these pressures collide. And number 4, explain why ethical decisions are rarely simple. If ethics feels uncomfortable, good. That discomfort usually means you're recognizing complexity instead of oversimplifying. Posgar repeatedly stresses that modern healthcare dilemmas exist because medicine is advanced enough that choices now have layered consequences. In other words, healthcare got smarter and ethics got harder. Let's briefly reconnect to last week. We talked about ethics versus morality. Morality equals personal beliefs, and ethics equals professional reasoning framework. In laboratory medicine, your personal opinions cannot guide patient care decisions. Professional standards must. That's why healthcare relies heavily on structured ethical principles. The 4 pillars of medical ethics, these act like guardrails for decision making. Autonomy, which is respecting patient rights and choices. Even though we don't interact directly with patients, consent and specimen handling still reflect autonomy. Beneficence, doing good, so producing accurate, high-quality slides is beneficence in action. Non-maleficence, do no harm, so poor fixation, contamination, or rust processing can cause diagnostic harm. Justice is fairness and equity. Every specimen deserves the same care, regardless of workload, status, or urgency pressures. Posgar highlights that ethical dilemmas often occur when these principles conflict with one another. Example, speed, beneficence for treatment timing versus accuracy, which is non-maleficence. And we also introduced the ethical decision triangle, reminding us that decisions involve facts, values, and professional duties. Today we start seeing how those collide in real healthcare systems. And here's the honest truth about healthcare ethics. Ethics becomes difficult when multiple right actions conflict, not when the answer is obvious. Posgar calls these contemporary ethical dilemmas because modern healthcare creates situations where There are no perfect answers. Sometimes every option carries risk. In histotechnology, release marginal slides and risk diagnostic difficulty, or delay reporting and affect treatment timing. Neither choice feels perfect. Real consequences exist. Unlike classroom scenarios, decisions affect diagnoses, treatment plans, surgical outcomes, and patient anxiety. Even though patients never see you, your work directly shapes their care trajectory. Time, pressure matters. Ethics rarely happens when you have unlimited time. It happens during stat requests, frozen sections, instrument failures, and staffing shortages. And pressure changes decision making, something PostGar discusses extensively in modern healthcare environments. Emotional and systemic factors play a role. Healthcare workers are human. Fatigue, hierarchy, productivity expectations, and workplace culture all influence ethical behavior. This is why ethical reasoning must be intentional, not automatic. Because when systems move fast, shortcuts become tempting. And here's the key takeaway I want you to remember. Ethical dilemmas are not signs that something is wrong with you as a professional. They are signs that you are working in real healthcare. So if you ever find yourself thinking, ugh, this situation feels uncomfortable and complicated, congratulations, you've officially entered professional practice. Because ethical reasoning isn't about finding perfect answers. It's about making thoughtful, defensible decisions when perfection doesn't exist. And that's exactly what we'll start practicing next. Right, now we get to the heart of today's topic. When we say ethical dilemma, we are not talking about obvious wrongdoing. This isn't someone falsifying results or skipping QC. Those are ethical violations, and honestly, those are easy. An ethical dilemma is harder because both options feel ethically defensible. According to PostGar, an ethical dilemma happens when two or more ethical principles collide. Each option has legitimate moral reasoning behind it, and no matter what you choose, there are consequences. So this is what we call right versus right, not right versus wrong. Let's translate that into laboratory reality. Imagine a pathologist wants a rapid frozen section result immediately because surgery is ongoing. But you recognize the tissue quality is borderline and rushing may compromise accuracy. Now you're balancing beneficence, helping the surgical team act quickly, versus non-malfeasance, avoiding harm from potentially inaccurate diagnosis. Neither value is wrong, and that uncomfortable tension, that's the ethical dilemma. One of the biggest misconceptions students have is thinking ethics gives you the correct answer. It doesn't. Ethics gives you a structured way to reason through difficult decisions when certainty doesn't exist, which, spoiler alert, is most of healthcare. This distinction is huge, and PostGar spends time on it for a reason. Ethical problem. Clear right versus wrong. Examples in the lab: fabricating results, skipping safety procedures, or reporting results you didn't verify. Those aren't dilemmas. Those are professional misconduct. You already know the answer. Now we move into right versus right territory. Both choices support an ethical value, but you cannot fully satisfy all principles at once. And here's the key idea. Harm cannot be completely avoided. That's uncomfortable, especially for healthcare professionals who entered this field to help people. In histotechnology, dilemmas often look subtle. Do you delay processing to preserve morphology or rush to meet turnaround time? Do you question an order that seems unusual, knowing it may slow care? Do you prioritize workload efficiency or individual case complexity? There's no skull and crossbones villain here, just competing goods. Ethical maturity is learning to recognize when you've moved from a simple rule violation into a genuine dilemma requiring judgment. So why does healthcare generate so many ethical dilemmas? Because healthcare is basically the perfect storm of complexity. PostGar emphasizes that dilemmas don't arise because professionals lack ethics. They arise because systems, science, and human intersect. Let's walk through these factors through a lab lens. Number one, limited resources. There are never unlimited reagents, staff, instruments, or time. You may have one embedding station, 10 stack cases, and surgeons waiting. Allocation decisions become ethical decisions. Number two, uncertainty in diagnosis. Histology lives here. Tissue interpretation is rarely absolute. Borderline dysplasia, ambiguous margins, artifact versus pathology. You're supporting decisions made under uncertainty, and uncertainty breeds ethical tension. Number three, patient diversity. Different cultures, beliefs, and expectations influence care decisions. Even though we don't always meet patients directly, their values still affect consent, testing decisions, specimen handling, and end-of-life care. Behind every cassette is a person with a story. Number four, institutional policies. Policies help standardize care, but sometimes policies and individual patient needs clash. You may think, policy says X, but this case feels different. That tension is ethical territory. And number five, technology advances. Histotechnology evolves fast. Molecular diagnostics, AI-assisted pathology, expanded testing capabilities. Just because we can test something doesn't always mean we should. And that's straight out of Postgar's discussion of modern ethical challenges. Technology increases power, and power increases ethical responsibility. This slide really summarizes everything we've been building toward. Healthcare isn't complicated because people are doing things wrong. Healthcare is complicated because multiple pressures operate simultaneously. Think about a single specimen arriving in your lab. You're balancing diagnostic uncertainty, limited resources, institutional expectations, advancing technology, and diverse patient needs, all at once. And notice something important. None of these factors are bad. They're necessary parts of modern medicine. But together they create environments where ethical dilemmas naturally emerge. Posgar describes this as the reality of contemporary healthcare ethics. Decisions occur within systems, not isolation. And here's the Histotech takeaway I want you to remember. Ethical dilemmas rarely announce themselves dramatically. They show up as everyday questions like, do I reprocess this block or risk delay? Should I question this labeling discrepancy? Is faster actually safer here? Ethics in laboratory medicine isn't philosophical theory. It's embedded in workflow decisions you will make multiple times a day, which means ethical reasoning is not an extra skill. It's a core professional competency, just like microtomy or staining quality. All right, now we get to one of the biggest reasons ethical dilemmas happen in healthcare. You are almost never responsible to just one thing at a time. Healthcare professionals, including laboratory professionals, constantly balance competing responsibilities. And honestly, this is where ethics stops being theoretical and starts feeling very real. You are balancing patient welfare, team collaboration, institutional expectations, and legal requirements, and even your own personal integrity. Now here's the important part for histotechnology students. Even though you may not be standing bedside, your decisions still sit right in the middle of these competing pressures. Let me give you a lab example. Imagine a surgeon is waiting on frozen section results. The OR wants answers immediately. The tissue is poorly oriented. You know rushing increases the risk of artifact or misinterpretation. So what wins? Speed? Accuracy? Team pressure? Patient safety? That tension right there, that uncomfortable, I can't perfectly satisfy everyone feeling, is exactly what Posgar describes as the environment where ethical dilemmas develop. Ethics isn't about being perfect. It's about deciding which responsibility must take priority in that moment and being able to justify why. This slide is one of my favorites because it addresses something students often underestimate. Laboratory professionals have enormous ethical influence, even without direct patient contact. Let's be very clear about what your work affects. You influence diagnosis timelines, treatment decisions, prognosis, and even patient anxiety levels. A delayed slide or poorly prepared specimen doesn't just stay in the lab, it travels outward. It affects clinical decisions, it affects whether a patient waits another day for answers, it affects whether therapy starts today or next week. And that means ethical responsibility absolutely exists behind the microscope. Postcard talks about how modern healthcare ethics extends beyond physicians and nurses to all healthcare contributors, especially those whose work informs decision making. Histotechnologists are part of the diagnostic chain. You are not passive participants, you are diagnostic enablers. No pressure, but also, yes, a little pressure. Because ethical practice in the lab means recognizing that accuracy, diligence, and honesty are patient care, even when the patient never sees you. Now we move into one of the most common ethical tensions in healthcare systems, and this one shows up constantly in laboratory medicine. Ethical tension often exists between doing what is best for one individual patient versus maintaining fairness and equity for all patients. This connects directly to the ethical principle of justice, which you reviewed last week. Here's a lab example. Suppose a physician calls asking you to rush their patient's biopsy. They insist it's urgent. Meanwhile, 10 other specimens are already in the queue. If you move one case ahead, what happens? You help one patient sooner, beneficence, but you potentially delay multiple others. Justice becomes challenged. Healthcare systems are designed to promote fairness, not favoritism. Postcard emphasizes that ethical dilemmas often arise because healthcare operates within systems, schedules, workflows, staffing limits, not unlimited individualized care. So ethical reasoning requires stepping back and asking, am I helping one patient in a way that unintentionally harms others? And yes, this is uncomfortable, but recognizing system level ethics is part of professional maturity in healthcare. Now we arrive at one of the biggest real-world ethical challenges in modern healthcare: resource allocation. And I promise, this is not just an administrative problem. This is a daily laboratory reality. Examples include staffing shortages, equipment limitations, deciding which testing gets priority, and turnaround time decisions. Every lab operates with finite resources. You do not have unlimited microtomes. You do not have unlimited embedding stations. And you definitely do not have unlimited staff on a Friday afternoon. So decisions must be made. Who gets processed first? What cases are prioritized? What can safely wait? This is where the ethical principle of justice gets tested the most. Justice means fairness in distribution of care and resources. But fairness doesn't always feel fair in the moment. Postcard discusses how modern healthcare systems must balance efficiency with ethical responsibility, and laboratory workflows are a perfect example. A stat oncology biopsy may ethically take priority over a routine specimen, but that decision still carries consequences. Someone else waits longer, and that's why ethical decision making in healthcare is rarely clean or comfortable. It's structured judgment under real world constraints. So if you're noticing a theme here, it's this. Ethical dilemmas don't appear because people are careless. They appear because healthcare is complex, resources are limited, and every decision affects more than one person. And yes, even at the microtome. Okay, now we arrive at one of the biggest drivers of modern ethical dilemmas: technology. Healthcare ethics didn't suddenly become complicated because people changed. It became complicated because medicine got really, really good at doing things we couldn't do before. And laboratory medicine sits right at the center of that change. Postcard talks about how advances in technology don't eliminate ethical problems. They actually create new ones. Let's look at what that means from a lab perspective. Genetic testing. We can now identify disease risk years, sometimes decades, before symptoms appear. Sounds amazing, right? But ethically, Should someone know they carry a gene for an untreatable disease? Who owns that information? Does insurance get access? What about family members who may share that risk? As lab professionals, we generate data that can affect not just a patient, but entire families. That's a heavy responsibility attached to a tiny tube of blood. AI diagnostics. Artificial intelligence is increasingly assisting pathology interpretation, imaging analysis, and pattern recognition. But here's the ethical question. If AI flags something and the human misses it, who is responsible? The algorithm? The lab? The pathologist? The institution? Technology doesn't remove accountability. It actually expands it. Advanced pathology testing, molecular panels, next-generation sequencing, and biomarker testing give incredibly detailed information. But sometimes we discover incidental findings, things unrelated to the original test. Example, a tumor panel reveals a hereditary cancer mutation. Now we must ask, do we report everything? What if the patient didn't consent to that information? What if it causes psychological harm? Posgar emphasizes that ethical dilemmas often arise when knowledge expands faster than policy. And histotechnologists are part of that pipeline, because without proper specimen handling and processing, none of this technology works. So yes, even embedding tissue correctly has ethical implications. Again, no pressure. This slide marks an important shift. Up to now, we've talked about why dilemmas exist. Now we're moving into what actually clashes when dilemmas happen. Ethical dilemmas rarely involve bad people making bad choices. Instead, they involve good professionals trying to honor competing ethical principles at the same time. And this is exactly what Posgar highlights. Healthcare decisions frequently involve principles that are all valid, but cannot all be satisfied simultaneously. Think of ethics like less like rules and more like a balancing act. In the laboratory, you see this constantly. Speed versus accuracy, privacy versus communication, individual patient needs versus workflow realities. So Section 3 focuses on understanding these clashes, because recognizing the conflict is the first step towards ethical decision making. Here are the classic ethical principle conflicts you'll see repeatedly in healthcare, and yes, absolutely in laboratory medicine. Autonomy versus beneficence. Autonomy means respecting a patient's choices. Beneficence means doing what we believe benefits the patient. These collide when a patient refuses something medically recommended. Example from the lab, a patient declines additional testing even though further stains or molecular work could clarify diagnosis. Clinically frustrating? Yes. Ethically wrong? No. Respecting autonomy sometimes means accepting decisions we wouldn't personally make. Beneficence versus non-malfeasance. Beneficence equals doing good. Non-malfeasance equals do no harm. Sounds similar until an action helps in one way but harms in another. Example, running an aggressive diagnostic workup may help identify disease early, but also increases cost, anxiety, or risk from additional procedures. Even in histology, repeated recuts may provide diagnostic clarity, but they consume limited tissue that cannot be replaced. You are constantly balancing benefit against potential harm. Justice versus individual care. Justice focuses on fairness and equitable distribution of resources. Individual care focuses on doing everything possible for one patient. This shows up daily in labs. Stat requests competing simultaneously, limited staffing, instrument downtime, and reagent shortages. You cannot prioritize everyone first. Ethical tension arises because fairness sometimes feels impersonal, but it protects the system as a whole. Posgar stresses that ethical healthcare decisions often involve choosing between competing goods, not good versus bad. Let's zoom in on autonomy, because this is one students often associate only with physicians or bedside care. But autonomy absolutely applies to laboratory professionals. Autonomy means patients have the right to make decisions about their care, refuse treatment or testing, and control access to their personal health information. And here's where lab ethics becomes very real. Even though you rarely meet patients, your work directly involves protected personal information and biological material that belongs to them. A tissue block is not just a specimen, it represents a person's body and identity. Laboratory examples of autonomy. A patient withdraws consent for research use of tissue. A patient limits genetic testing disclosure. A patient refuses additional diagnostic procedures. Your responsibility is not to judge the decision, but to respect it professionally. Challenges arise when patient choices conflict with medical recommendations. For example, a physician requests additional testing, but consent documentation doesn't support it. Your ethical obligation is to follow policy and patient rights, even if it slows the process. And this is a key takeaway from POSBAR. Ethical practice is not about always agreeing with decisions. It's about respecting rights while maintaining professional integrity. Autonomy reminds us that you are not just producing slides. You are participating in decisions that affect diagnosis, treatment pathways, and patient trust in healthcare. Ethics exists in every cassette, every label, every result released. Now we move into beneficence, which sounds fancy but really just means act in the patient's best interest. And here's where laboratory medicine gets interesting, because we rarely meet the patient, yet our work directly determines what happens to them next. In histotechnology, beneficence shows up in decisions like ensuring optimal fixation so tissue morphology is preserved, selecting correct embedding orientation, preventing section artifacts that could obscure diagnostic features, recutting when quality is questionable, instead of hoping it's good enough. Because remember, the pathologist's interpretation is only as good as the slide we produce. Now, the slide mentions that questions arise when providers disagree about what best means, and this happens more often than students expect. For example, one clinician wants rapid turnaround. Another wants additional levels or special stains for certainty. The lab must balance speed, accuracy, and resource use. Beneficence is not always obvious because outcomes are uncertain. You may do everything correctly and still not know whether the result changes treatment. But ethically, beneficence asks, did we act with the patient's welfare as the primary goal? Not convenience, not workflow pressure, not that's how we've always done it. Next is non-malfeasance, probably the most famous ethical phrase in healthcare: do no harm. But here's the important nuance. Non-malfeasance does not mean harm never happens. In laboratory medicine, harm can occur even when everyone is trying to do the right thing. Think about real lab scenarios. A delayed specimen arrives partially autolyzed. Staffing shortages slow turnaround time. Limited tissue forces difficult testing choices. A frozen section must be interpreted quickly under imperfect conditions. The ethical question becomes, how do we minimize harm when risk cannot be eliminated? For histotechnologists, this looks like recognizing processing errors early, communicating concerns immediately, rejecting compromised specimens when necessary, and documenting deviations honestly. One poorly prepared slide can lead to misdiagnosis, repeated procedures, or delayed treatment. So non-malfeasance in the lab is deeply tied to quality assurance. Every time you double-check labeling or remake a questionable section, you are practicing ethical medicine, even if no one ever sees that decision. Now we shift to justice, which focuses on fairness. Justice asks, How are healthcare resources distributed? And yes, laboratories are absolutely part of this conversation because resources in healthcare are never unlimited. Justice shows up in laboratory practice through test prioritization, workflow triaging, allocation of specialized stains or molecular testing, or turnaround expectations across patient populations. For example, STAT cancer biopsies may move ahead of routine specimens. Limited tissue samples must be aliquoted carefully between tests. Expensive molecular assays may require clinical justification. Justice means balancing individual patient needs, system-wide fairness, responsible use of resources. This is where ethics intersects with real operational laboratory management. And here's a subtle but important point. Justice is not equality. Equality means everyone gets the same thing. Justice means patients receive what they need to achieve fair outcomes. That distinction becomes very real when laboratories must prioritize cases that directly impact survival or urgent treatment decisions. And this slide brings everything together. Ethical dilemmas happen when two correct principles conflict. Not right versus wrong, right versus right. In histotechnology and laboratory medicine, common collisions include speed versus accuracy. Surgeons want frozen section results immediately, but rushing increases artifact risk. Individual need versus system fairness. One complex case may require extensive testing, but resources must remain available for other patients. Beneficence versus non-malfeasance. Performing more testing might help diagnosis, but could exhaust limited tissue needed later. Here's the key takeaway students should internalize. No ethical principle automatically wins. Ethical practice is not rule following, it is professional judgment. And this is where laboratory professionals grow from technicians into healthcare professionals. Every difficult decision strengthens critical thinking, professional accountability, and patient-centered reasoning. In other words, those uncomfortable moments in the lab, they are not interruptions to your professional development. They are your professional development. All right, now we shift from what ethics are to what ethics look like when you are actually working in the laboratory. Up to this point, we've talked about principles, autonomy, beneficence, non-malfeasance, and justice, almost like separate ideas. But in real healthcare environments, ethical decisions don't arrive labeled. They show up as everyday workflow problems. In histotechnology and laboratory medicine, ethical decision-making rarely feels dramatic. It usually looks like a specimen that arrives mislabeled, a rush request that skips normal workflow, a stain result that doesn't match clinical expectations, or a situation where speed pressures compete with accuracy. And here's the key idea for this section. Ethics is not an extra task added to your job. Ethics is embedded in every professional decision you make. Every block you embed, every slide you release, every result you verify carries ethical weight, even when no one is watching. So now we're going to walk through how professionals actually make ethical decisions step by step, using a structured process you can apply in real laboratory situations. Ethical decision-making is not guessing, and it's not relying on gut instinct alone. Professionals follow a structured reasoning process, even if they don't consciously think through each step every time. Let's walk through this through a laboratory lens. First, identify the dilemma. First, recognize that an ethical issue exists. In the lab, this might look like a specimen identity concern, pressure to release results quickly, a questionable tissue quality issue, or conflicting instructions from different providers. Ethical problems often begin as discomfort, that feeling of something here isn't right. Number 2, gather facts. Before acting, you verify information. Histotechnology example, confirm patient identifiers. Check fixation time. Review accessioning documentation. and verify staying protocols or instrument performance. Ethics without facts becomes assumption, and assumption creates harm. Number 3, identify stakeholders. Who is affected? Not just the pathologist or clinician, but the patient, the healthcare team, future treatment decisions, and even other patients relying on workflow accuracy. 4, apply ethical principles. Now you evaluate, are we protecting patient autonomy, acting in their best interest, minimizing harm, maintaining fairness? This is where principles move from theory into action. 5, evaluate outcomes. Ask, what could happen if I proceed? What happens if I delay? Which choices best protects patient safety? Ethical professionals think one step ahead. In reality, experienced laboratorians cycle through these steps quickly, sometimes in seconds, but the framework is always there. One of the biggest misconceptions students have is thinking ethical decisions only affect one person. In healthcare, especially laboratory medicine, decisions ripple outward. Let's look at who is actually affected. The patient. Even though histotechnologists rarely meet patients, every slide represents a real person waiting for answers. A processing shortcut or labeling error doesn't stay in the lab. It follows the patient into diagnosis and treatment. Family. Diagnostic outcomes influence treatment decisions, prognosis discussions, and emotional and financial planning. Your technical work carries human consequences. Providers. Pathologists and clinicians depend on laboratory accuracy to make clinical decisions. If tissue processing introduces artifact, interpretation becomes harder and uncertainty increases. Laboratory staff. Your decisions affect coworkers. Workflow delays, quality investigations, regulatory reporting, workplace trust. Ethical practice protects the entire team. Institution. Hospitals and laboratories operate under accreditation and regulatory standards. Errors can impact patient safety metrics, accreditation status, or legal liability. And lastly, future patients. This is the one students often overlook. When ethical standards are maintained consistently, systems improve, benefiting patients you will never meet. Ethical decisions are not individual acts. They are system-level protections. This slide brings everything together. Ethics in healthcare is not about memorizing rules. If ethics were just rule memorization, automation could replace professional judgment entirely, and we know that's not possible. Instead, ethical practice requires professional judgment, which develops over time. Ethical decision-making relies on critical thinking. You must interpret situations, not just follow procedures blindly. Example, a technically acceptable slide may still be diagnostically inadequate. Recognizing that requires judgment. Experience. With experience, you begin recognizing patterns. Port fixation artifacts, processing issues, unexpected staining results. Experience helps you anticipate problems before harm occurs. Communication. Ethical professionals speak up. That may mean contacting accessioning, alerting a supervisor, or discussing concerns with a pathologist. Silence can sometimes be the unethical choice. Accountability. Professional responsibility means owning decisions and documenting actions appropriately. Healthcare trust depends on accountability. The key takeaway? Ethics is not about perfection. It's about reasoned, informed decision making in uncertain situations. And this is where histotechnologists become true healthcare professionals, not just technicians performing tasks, but experts applying judgment to protect patient outcomes. Ethical dilemmas don't just live in textbooks, they live in people. And in laboratory medicine, they often live quietly. Histotechnologists frequently experience moral stress because we operate in a space where patient outcomes matter deeply, but our control over decisions can be limited. In the lab, this might look like knowing a specimen needed faster processing, but staffing shortages delayed it. Recognizing suboptimal fixation, but being unable to recollect tissue. Feeling pressure to push slides through when quality really requires more time. Unlike frontline clinicians, laboratory professionals often experience invisible responsibility. We carry the weight of diagnostic accuracy without direct patient interaction or recognition. Over time, repeated ethical tension contributes to emotional fatigue, professional frustration, and burnout risk. And here's the important takeaway for students. Stress in healthcare is not always workload stress. Sometimes it is value conflict stress, when what you believe is right collides with system realities. That experience is common, normal, and worth talking about openly in professional practice. Moral distress occurs when you know the ethically appropriate action, but something prevents you from doing it. In laboratory environments, constraints often include turnaround time pressures, staffing limitations, institutional policies, hierarchical decision structures, and resource availability. A classic histology example, you recognize a biopsy as poorly fixed and may compromise diagnosis. You know the ideal action would be to recollect or provide additional communication, but clinical urgency or workflow constraints prevent intervention. That creates internal conflict. Over time, unresolved moral distress leads to what's called moral residue, the lingering feeling that professional standards were compromised even when you personally did nothing wrong. This is why moral distress is particularly common in laboratories. High responsibility, limited authority, strong professional standards. Healthy teams reduce moral distress by encouraging speaking up safely, collaborative problem solving, quality focused culture rather than speed only metrics. Ethics is not just about decisions, it is also about supporting professionals who must live with those decisions. Now we shift from general ethics into situations that are uniquely laboratory centered. Histotechnology ethics often looks different from bedside ethics because our dilemmas revolve around specimen handling, diagnostic integrity, workflow prioritization, quality versus efficiency, or communication gaps between departments. Laboratory professionals act as guardians of diagnostic accuracy. Every paraffin block, every section thickness, every stain quality decision carries ethical implications because diagnostic interpretation depends on technical preparation. Unlike many healthcare roles, small technical decisions in the lab can silently influence cancer diagnosis, surgical management, treatment planning, and patient prognosis. So laboratory ethics is rarely dramatic, but it is deeply consequential. This section focuses on real-world dilemmas histotechnologists encounter daily, often without realizing they are ethical decisions. Specimen prioritization is one of the most common ethical balancing acts in histology. Every lab faces competing demands: stat frozen sections, small critical biopsies, large routine surgical cases, or limited staffing and instrument capacity. The ethical question becomes who or what gets processed first. Examples include a stat transplant biopsy arriving during heavy workload, a suspected malignancy competing with high specimen volume, multiple surgeons requesting priority simultaneously. This creates tension between ethical principles: beneficence, helping the patient needing urgent diagnosis; justice, treating all cases fairly; non-malfeasance, avoiding harm caused by rushed or poor quality processing. Histotechnologists do not make these decisions randomly. Ethical prioritization relies on established laboratory protocols, clinical urgency criteria, communication with pathology and clinical teams, professional judgment. Important teaching point here. Speed alone is not ethical if it compromises quality. A fast but poorly prepared slide can delay diagnosis more than a carefully processed one. Ethical laboratory practice means balancing urgency with diagnostic reliability, because accuracy ultimately serves the patient best. All right, welcome to one of the most real ethical dilemmas you will ever face in laboratory. Not theoretical, not philosophical, daily. Healthcare constantly pushes for faster turnaround times because faster diagnoses can mean faster treatment, and that is important. But here's where ethics enters the room. Speed and quality do not always increase together. As workflow pressure increases, more specimens, stat requests, staffing shortages, we approach what this slide calls the ethical threshold. That threshold is the point where shortcuts start feeling tempting. You might hear things like, just rush this one. We don't have time to repeat it. It looks close enough. And this is exactly what Posgar discusses in Chapter 2. Modern healthcare systems create ethical tension through productivity demands and resource limitations. But here's the non-negotiable truth. Diagnostic integrity must always win over speed, because a histology slide is not just a slide. It represents a treatment decision, a surgery plan, or sometimes a life-altering diagnosis. When quality drops, fixation errors increase, labeling mistakes happen, QC steps get skipped, and patient risk rises quickly. That risk zone on the graph, that's where ethical decision-making matters most. A professional histotechnologist understands fast is good, accurate is required. Your ethical responsibility is not to be the fastest person in the lab. It's to be the person whose work clinicians can trust. Now let's talk about something students often underestimate ethically: documentation. And I know, documentation doesn't sound exciting. Nobody entered histotechnology thinking, I can't wait to log timestamps. But ethically, documentation is everything. Posgar emphasizes that modern healthcare ethics includes accountability and traceability, meaning every step must be verifiable. Why? Because laboratory medicine works like a chain of custody. Every specimen moves through multiple hands. Receipt, cassette labeling, processing, embedding, sectioning, staining, and reporting. If one step isn't documented, the chain breaks. And when traceability breaks, errors cannot be investigated, patient safety is compromised, and legal liability increases. Shortcuts like skipping log entries, back entering data later, or assuming someone else documented it may feel harmless in the moment, but ethically, they remove transparency. Complete documentation does three important things: protects the patient, protects the laboratory, and protects you. Transparency isn't about surveillance, it's about trust. If someone reviews your work months later, the record should clearly answer who handled it, when, what was done. Good documentation is ethical practice made visible. This slide moves us into one of the hardest ethical skills in healthcare: speaking up. Most ethical dilemmas are not dramatic life or death decisions. They look more like noticing a mislabeled specimen, questioning a rushed step, or recognizing something feels off. Posgar discusses how hierarchical healthcare systems can unintentionally discourage communication, especially for newer professionals. And let's be honest, laboratories absolutely have hierarchy: supervisors, pathologists, senior techs, and trainees. Speaking up can feel uncomfortable. Students often worry, what if I'm wrong? What if I upset someone? I'm just a student/new hire. But silence carries ethical risk. When errors go unreported, mistakes repeat. Patient harm becomes possible and moral distress increases. Notice the contrast on the slide. A safe environment encourages questions and reporting. A fear-based environment leads to silence, stress, and ignored errors. Professional courage in laboratory medicine doesn't mean confrontation. It means respectful advocacy for patient safety. Sometimes the most ethical sentence in a lab is simply, "Can we double check this?" Ethics in healthcare often sounds quiet, but it protects patients loudly. Here's something students are often surprised to learn. Ethical decisions in healthcare are almost never made alone. Posgar highlights that contemporary healthcare ethics is increasingly collaborative because patient care depends on interdisciplinary expertise. In laboratory medicine, decisions involve histotechnologists, pathologists, lab supervisors, quality personnel, and clinicians. Each role sees a different piece of the puzzle. A histotechnologist may notice processing artifacts. A pathologist may recognize diagnostic implications. A supervisor may understand workflow constraints. Ethical practice happens when those perspectives come together. Think of ethics like the puzzle pieces shown here: integrity, accountability, expertise, and patient safety. No single role completes the picture alone. Strong ethical labs encourage discussion, consultation, and shared responsibility. And honestly, this should feel reassuring. You are not expected to carry ethical decisions by yourself. Professional maturity includes knowing when to ask, "What do you think? Should we review this together? Let's get another set of eyes." Collaboration is not weakness. In healthcare, collaboration is ethical strength. All right, now we're going to talk about something students are often surprised by once they enter the real laboratory world. Ethical problems are not always caused by bad people. Very often they are created by system pressure. Healthcare, including laboratory medicine, operates inside large organizational systems. And those systems run on things like productivity expectations, staffing limitations, financial realities, and turnaround time metrics. None of those are inherently unethical. Hospitals have to function efficiently. Labs have to stay operational. But here's where ethical tension appears. You may be asked, directly or indirectly, to work faster, process more cases, or keep things moving. And sometimes that pressure quietly pushes against best practice. Posgar emphasizes that modern ethical dilemmas frequently arise when organizational goals and professional obligations collide. For example, in histotechnology, cutting corners on fixation time to meet stat expectations, skipping a verification step because the queue is backed up, or feeling pressure not to question a questionable specimen request. The key idea here is this: ethics doesn't happen in isolation. It happens inside systems that influence behavior. Your responsibility as a professional is not to ignore institutional realities, but also not to let productivity override patient safety or diagnostic integrity. Because at the end of the day, slides are not just slides. They represent real patients waiting for answers. So far, we've talked about ethical stress, pressure, and dilemmas. Now we shift into something incredibly important: how ethical problems actually get solved. And spoiler alert, it's rarely through policy manuals alone. Ethical resolution in healthcare almost always depends on communication. Poscar highlights that contemporary healthcare ethics relies heavily on collaboration, dialogue, and shared reasoning rather than individual decision making. In laboratory medicine, this matters even more because histotechnologists, pathologists, lab managers, and clinicians are all working from different perspectives but toward the same goal: accurate patient diagnosis. Ethical communication is what turns conflict into problem solving instead of workplace tension. So, this next section focuses on practical skills, the tools professionals use every day to resolve ethical challenges without escalating conflict or compromising patient care. Ethical communication is not just being nice, it's actually a professional competency. And in the laboratory, communication often happens around uncertainty, which is exactly when ethics becomes important. Let's break down the three core skills here. Number 1, respectful dialogue. This means listening first, not just waiting for your turn to talk. In histotechnology, respectful dialogue might sound like, "Can we double check this specimen ID together? I may be misunderstanding, but this fixation time seems short." Notice the tone. You're addressing the issue, not attacking the person. Ethical communication protects relationships and patient safety at the same time. Number 2, evidence-based reasoning. Healthcare ethics is grounded in facts, not opinions. Instead of saying, "I don't think this is right," you say, "QC results suggest this stain may not be reliable. Documentation shows this specimen skipped verification." Data removes ego from the conversation. And histotechnologists are uniquely strong here because our work is inherently evidence-driven. Number 3, professional tone. Tone matters more than students expect. Even correct concerns can be ignored if delivered aggressively. Professional tone communicates calm confidence, patient focus, and shared responsibility. Your goal isn't to win an argument. Your goal is to reach the safest decision for the patient. Let's clear up a very common misconception. Disagreement does not equal unprofessional behavior. In fact, ethical disagreement is often a sign of a healthy healthcare environment. Poscar discusses how modern healthcare encourages interdisciplinary discussion because complex decisions rarely have one obvious answer. In laboratory practice, disagreements may occur about specimen adequacy, stain interpretation, prioritization decisions, and quality versus turnaround time. Two professionals can look at the same slide and reach different conclusions, and that's okay. What matters is how disagreement happens. Healthy ethical disagreement includes explaining reasoning clearly, using evidence rather than hierarchy, remaining focused on patient outcomes. Unhealthy disagreement looks different. Silence due to intimidation, dismissing concerns without review, or relying solely on authority instead of reasoning. Here's an important professional truth. Silence can be more dangerous than disagreement. Many laboratory errors historically occurred not because someone didn't notice a problem, but because someone didn't feel comfortable speaking up. Ethical discussion improves outcomes because it introduces multiple perspectives before decisions are finalized. So disagreement, when handled professionally, is not conflict. It's quality assurance in action. Okay, here's something students are often surprised to learn as well. You are never expected to solve every ethical dilemma alone. Healthcare systems actually build structures specifically for situations where the right answer isn't obvious, and that's where ethical consultation comes in. Hospitals and larger laboratory systems often rely on ethics committees. These groups usually include physicians, nurses, administrators, legal advisors, and sometimes laboratory professionals. Their job is not to punish people. It's to help teams think through complex situations using structured ethical reasoning. Think of them as the healthcare version of a professional sounding board. Ethics consultation may involve reviewing institutional policies, discussing conflicting responsibilities, clarifying patient-centered priorities, and helping teams navigate disagreement constructively. And here's the histotechnology connection. In the lab, ethical consultation might occur when specimen handling decisions conflict with workflow pressures, unexpected findings raise reporting questions, or policies don't clearly address a real-world situation. Poscar emphasizes that modern healthcare ethics is interdisciplinary, meaning ethical decisions improve when multiple perspectives are involved. And honestly, that makes sense. No single role sees the entire patient picture, but together we get closer to it. This slide is one of the most important mindset shifts as you transition from student to professional. Ethics is not about knowing everything. It's about knowing when you don't know enough. Professional accountability includes three major behaviors. 1. Recognizing limits. You are ethically obligated to acknowledge when something is outside your competence or confidence level. That's not weakness, that's patient safety. In histotechnology, this could look like uncertain staining quality, questionable specimen orientation, or results that don't match expected morphology. Ignoring uncertainty is risky. Recognizing it is professional. Number 2, asking questions. Healthcare culture sometimes makes people feel like asking questions means they're unprepared. Reality check. The safest labs are the ones where people ask questions constantly. Questions prevent assumptions, and assumptions cause errors. Number 3, seeking guidance. Consulting a senior tech, supervisor, or pathologist is not escalation, it's collaboration. POSCAR highlights accountability as a core ethical duty because healthcare outcomes depend on collective reliability, not individual ego. In short, ethical professionals protect patients by protecting accuracy. Now we move from theory into application. Up to this point, we've talked about ethical concepts, principles, communication, teamwork, pressure, and accountability. This section answers the real questions students usually have. Okay, but what do I actually do when an ethical dilemma happens? Ethical reasoning is not instinct, it's a process. And just like embedding tissue or troubleshooting staining artifacts, structured processes reduce error. POSCAR describes ethical decision making as a deliberate evaluation of responsibilities, consequences, professional standards, and patient impact. In laboratory medicine, ethical reasoning often happens quickly and quietly, deciding whether to rerun a questionable slide, addressing documentation concerns, or speaking up when workflow shortcuts appear. You may not call it ethics in the moment, but it absolutely is. This section gives you a framework you can mentally run through, almost like a diagnostic checklist, when things feel ethically uncomfortable. Slide gives you a practical tool, and honestly, this is one of the most useful takeaways from the entire lecture. Ethical decisions begin with questions, not answers. When something feels off in the lab, pause and walk through 4 core questions. Number 1, what principles are involved? Ask yourself, does this affect patient safety, diagnostic accuracy, or professional duty or integrity? In histotechnology, accuracy is not just technical, it's ethical. Number 2, who benefits? Consider patient outcomes, diagnostic clarity, and team trust. Sometimes the fastest solution benefits workflow, but not the patient. Number 3, who may be harmed? This includes more than patients. Clinicians relying on results, coworkers downstream, institutional credibility, and even your own professional license. POSCAR reminds us that unintended harm still carries ethical consequences. And 4, what alternatives exist? Ethical reasoning opens options. Consult a supervisor, repeat processing, request additional testing, and document concerns. Rarely are you limited to only 2 choices. And notice the final step. Ethical decisions are documented, transparent, and patient-focused. Because in laboratory medicine, ethical practice is not dramatic, it's consistent. It's the quiet decisions that ensure every slide represents the patient truthfully. And that's really the core message of this entire unit. Ethical laboratory practice begins with curiosity, not certainty. One of the hardest things to learn in healthcare ethics is that there is not always a single right answer. In textbooks, problems look clean and straightforward. In real laboratory practice, they rarely are. You may encounter situations where a specimen arrives late, but treatment decisions are waiting. Tissue quality is poor, yet the clinician needs information quickly. A result looks unusual, but repeating testing will delay turnaround time. A coworker handles something differently than you would. In these moments, you are balancing competing responsibilities: accuracy, efficiency, professional relationships, and most importantly, patient safety. That means ethical decision making often involves choosing the most responsible option, not a perfect one. Ethical success therefore looks like thoughtful reasoning, so slowing down enough to evaluate risks and consequences, transparency, documenting decisions and communicating concerns clearly, professional integrity, prioritizing patient care even when it is inconvenient. For example, a histotechnologist might delay sign out to recut a questionable section. That decision may frustrate workflow temporarily, but it protects diagnostic accuracy. Ethics in laboratory medicine is less about dramatic dilemmas and more about everyday professional judgment. You are not expected to be perfect, but you are expected to be thoughtful, honest, and accountable. Ethical reasoning is not something you either have or do not have. It develops over time, just like your technical laboratory skills. Think back to when you first learned microtomy. At the beginning, every block felt unpredictable. Over time, you learn to recognize tissue resistance, knife angle problems, and when something just didn't look right. Ethical judgment develops in the same way. Early in your career, situations may feel uncertain because you are still learning how clinical decisions connect to patient outcomes. With experience, patterns begin to emerge. Ethical growth happens through experience, such as encountering real cases where decisions matter, reflection by asking yourself what went well and what could be improved, and discussion, hearing how colleagues or pathologists approach the same issue, as well as mentorship, learning professional reasoning from experienced laboratorians. For example, an experienced histotechnologist may immediately recognize when tissue processing artifacts could mislead interpretation and will proactively consult before slides reach the pathologist. That instinct is not luck. It is ethical reasoning shaped by repeated learning moments. Over time, professionals shift from reacting to problems to anticipating them. Good ethical judgment develops the same way good sections do, through practice, feedback, adjustment, and patience. To this point, we've focused on understanding ethical principles and professional responsibility. Next, you will begin applying those concepts. In week 3, you will work through realistic laboratory scenarios designed to mirror situations professionals encounter in clinical settings. You will practice asking structured questions such as what ethical principles are involved, who could benefit or be harmed, what additional information is needed, what actions are professionally appropriate. The purpose is not to memorize answers. Instead, you are learning a repeatable decision-making process, a framework you can use whenever you encounter uncertainty in practice. This is where ethics moves from theory into professional skill. So why spend time talking about ethics in a laboratory course? Because ethical decision-making is not separate from technical work. It is built into every step of the diagnostic process. Histotechnologists may not interact directly with patients, but every slide you produce becomes part of a medical decision that affects a real person. Small laboratory choices can have large downstream consequences. For example, choosing whether to re-embed poorly oriented tissue can affect whether a tumor margin is accurately evaluated. Deciding to question an unusual staining result may prevent a misdiagnosis. Speaking up when specimen labeling looks questionable can stop an error before it reaches the patient record. These moments may feel routine, but they are ethical decisions because they involve responsibility, judgment, and patient safety. Ethical dilemmas prepare you for high-stakes healthcare decisions, where accuracy directly influences treatment plans. Complex patient situations, where time, pressure, and uncertainty exist simultaneously, and professional leadership roles, where others rely on your judgment and willingness to speak up. Every specimen moves through a chain: tissue, slide preparation, interpretation, diagnosis, and patient outcome. What happens in the histology lab is not isolated from patient care. It is foundational to it. The goal of learning ethical reasoning now is to help you recognize that your professional decisions matter long before you ever hold a leadership title. Every careful choice you make contributes to safer healthcare, and every difficult decision you encounter is not just a challenge, it is training for the responsibility you are growing into as a laboratory professional. All right, let's bring everything together and talk about what this actually means in real laboratory practice. Ethical dilemmas almost never show up as obvious right versus wrong situations. Instead, they usually involve competing values. For example, you might feel pressure to work quickly to keep workflow moving, while also knowing accuracy and verification must come first. Both efficiency and patient safety matter, but when they conflict, ethical reasoning helps you decide what takes priority. Another important takeaway is that ethical principles guide our thinking, but they do not dictate a single answer. Principles like beneficence or non-maleficence gives us a framework, not a checklist. Two professionals may approach the same situation slightly differently, but both can still reason ethically if they are prioritizing patient welfare and professional standards. And this is where laboratory professionals sometimes underestimate their role. Even though we are not typically at the bedside, we are deeply connected to patient outcomes. A poorly prepared slide, an overlooked labeling error, or a decision to stay silent about a concern can directly affect diagnosis and treatment. Ethics in the lab is therefore not abstract philosophy. It is part of daily technical practice. Finally, communication and reasoning are essential because ethical problems are rarely solved alone. Discussing concerns with coworkers, supervisors, or pathologists is often how safe decisions are reached. Ethical practice is collaborative, not isolated. So the big message here is this: ethical thinking is not an extra skill added onto laboratory work. It is part of doing laboratory work correctly. Let's talk about some misconceptions that people often bring into healthcare ethics. First, ethics is not just personal opinion. In healthcare, decisions cannot be based solely on what someone personally feels is right. Ethical practice relies on shared professional standards, patient safety expectations, and evidence-based reasoning. That consistency is what allows patients to trust healthcare systems. Second, ethics is not blindly following rules. Rules and policies are incredibly important, but ethical reasoning asks us to understand their purpose. Policies exist to protect patients, maintain accuracy, and reduce harm. When we understand the reasoning behind them, we are better able to apply them appropriately in complex situations. Another misconception is that ethics means avoiding conflict. In reality, ethical practice sometimes requires respectful disagreement or speaking up. For example, questioning a mislabeled specimen or clarifying unclear documentation may feel uncomfortable, but remaining silent could cause harm. So, what is ethics? Ethics is structured reasoning. It's a systemic it's a systematic way of analyzing a situation, considering consequences, and choosing actions that align with professional responsibility. Think about how you troubleshoot staining problems. You don't guess randomly, you evaluate fixation, processing, reagent quality, and timing step by step. Ethical reasoning works exactly the same way. It is analytical, thoughtful, and deliberate. Now let's connect ethics to something bigger, your development as a professional. Professional identity is not formed only by technical competence. Yes, knowing how to embed tissue correctly or cut consistent sections matters, but professionalism is really revealed through decision making and judgment. Ethical reasoning helps transform someone from a student learning procedures into a trusted healthcare professional. Trust develops when others know your work is careful, honest, and patient centered. Reliability also comes from ethical consistency. When coworkers know you will double-check identifiers, report concerns, and prioritize quality over convenience, you become someone the team depends on. And accountability is a huge part of healthcare identity. Laboratory professionals may work behind the scenes, but we are accountable for results that guide diagnoses, surgeries, and treatments. Ethical thinking reinforces awareness that every specimen represents a real person in a real clinical decision. Over time, these behaviors shape how you see yourself professionally. You stop thinking only about completing tasks and start thinking about contributing to patient care systems. So, ethical reasoning isn't just about avoiding mistakes, it's part of becoming the kind of professional others respect and patients ultimately rely on. So, as we finish today, I want you to remember one key idea. Ethics is not about finding easy answers, If a situation feels complicated or uncomfortable, that usually means ethical reasoning is actually required. The goal isn't perfection, it's making responsible, informed decisions when the answer isn't obvious. In histotechnology, small actions can have big consequences. A mislabeled cassette, a rushed decision, or staying silent when something seems wrong can directly impact patient care. Ethical practice means slowing down enough to think, asking questions when needed, and remembering that every specimen represents a real person depending on the accuracy of our work. And honestly, that responsibility is what makes this profession so important. All right, that brings us to the end of this lecture. Excellent work today, guys.